Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program. In a late-night speech, the president focused on two things: a possible extension of the Luzon-wide community quarantine, plus the funding the country needs to address the COVID-19 pandemic. Also, the president responds to an open letter seeking help not just for the poorest of the poor, but also for the middle-class Filipinos. Cavite Governor Jonvic Remulla joins us in the program. And later, we speak to the man who spearheaded the creation of COVID-19 test kits made by Filipino scientists. President Rodrigo Duterte finally addressing the question on everyone's mind. In his second COVID-19 report to the nation, the president reveals that he is inclined to extend the community quarantine up to the end of April. Mr. Duterte adds that government will need more funds to help the poorest of the poor. He also agreed with Cavite Governor Jonvic Remulla's appeal that even middle-income class families need help. In a letter to the president, Governor Remulla described the pandemic as a time of crisis for everyone.
We are inclined to extend the lockdown up to April 30. Tignan natin after that. In the meantime, magdo-double time kami doon sa tinatawag ninyong middle class. How is it defined or arrived at correctly? We will talk about this.
Let's go straight to the source of the story. We have Cavite Governor Jonvic Remulla. Governor, welcome to the show. Thank you for joining us. I'm going to go ahead and ask my question already, sir. So the president agreeing with you that the middle class should be included. But was it clear, Governor, to you kung isasama na yung middle class sa social o sa social amelioration program?
Nothing was clear, but I'm glad that it's at least part of the conversation. The problem was that before I wrote the letter, it was the middle class was largely ignored, and I'm glad now that hopefully now inside the halls of Malacanang, I hope that the conversation includes the middle class too.
Right. So it's clear to you and it's clear to me, sir, that the president is still looking at the low-income families for the social amelioration program. Pero pag-uusapan na nila ng mga miyembro ng gabinete kung paano isasama ang middle-class families. I wanted to ask you, Governor, ano ho ba ang sinasabi ng mga kababayan niyo dyan sa Cavite, yung nasa middle-class families ninyo dyan, sir?
Cavite is composed of 829 barangays and over 2,000 subdivisions. And these subdivisions are middle class, hardworking, decent people who pay mortgage, who pay their salary loans, who pay their car loans, and their savings rate is very low. The problem is that in the last 3 weeks, most of it has been depleted, and they were hoping that they would be part of the social amelioration program. However, when the DSWD came out with their guidelines, they suddenly said that not everyone will be included. So it was crazy here for a few days. Naawa po ko sa mga barangay captain, minumura ng mga tao dahil ba't dito sila binigyan form. So everyone is hurting. Everyone is hurting. Not only the poorest of the poor, but even the middle class are hurting.
And that's why, Governor, naisipan niyo pong sulatan si Pangulong Rodrigo Duterte. There's a part po dun sa liham ninyo, there was one in English and one Filipino, na sinabi niyo, yung lalawigan niyo po ay 70% ng mamamayan ay migrants. And then you said that 300,000 ay nagtatrabaho sa Maynila at yung 400,000 sa economic zone. Sir, can you please explain this to me? Because I also want to find out, ano ho ba ang classification nyo ng middle-class families?
Well, I have to classify these subdivisions as middle class already because the equity that they have in their homes is close to 1 million pesos already. They bought the homes at 300, 400,000. In the last few years, the value has appreciated. When anyone in the country has assets over 500,000, they should be considered middle class already. But there is another side to that story. They are we consider asset heavy,
Mm-mm.
but they are cash flow poor. So that is where the distinction should be. They think that because they live in the subdivision that they don't deserve to be helped anymore, but that's not true. If the poor are hurting, the middle class are hurting too, and they should be included in this program.
Governor, who's to determine sa palagay ninyo? Kasi ito po yung tanong possibly to many people, who constitutes the middle class? Kasi very easily somebody will say, ako middle class ako. Baka naman sabihin ng gobyerno, ay ikaw, hindi ka middle class. Is it going to be, there has to be a standard by which one is classified as part of the middle class? For example, sir, kailangan ho ba yung income ang tinitingnan? Kailangan ho ba single or double income? Kailangan ho ba single mother? Or ano ho kaya ang basis to classify them as middle-class families?
Um, there is no perfect database. What they're doing now is giving away forms, filling it up, and then the DSWD will assess. And that takes weeks. If you're talking about 18 million families to be helped, it cannot possibly be done in 3 or 4 days
Mm-mm.
and then distributed in 3 or 4 days after because the sheer number of applicants is just too large. I have realized that there is no single database that is credible, but there is one resource that they can explore. I am sure that 99% of the
Tap.
Filipinos here in Luzon are tapped into utilities such as Meralco and such as their local electric utilities. And all of them pay, and all of them have bills. And it is classified whether it is residential or business. I think with the residential areas, they can extrapolate from the number of kilowatt hours, how much they can consume, and then they can make a formula on who is middle class
Mhm.
and who is, because the higher consumers obviously can they have air conditioners and they can afford more, but the lower consumers are best determined by the number of kilowatt hours that they consume every day, and that I think is the best way to determine who deserves and who doesn't.
That becomes a little confusing though, Governor Remulla, because if there is no clear data, posible ho ba na magkaroon ng, sabi mo nga kanina, no, just taking after what you said a while ago, na nagagalit na po yung ilang mga kababayan niyo dyan dahil yung iba, ang pakiramdam nila ay kasama sila dun sa social amelioration program. Yung iba naman ay hindi nasasama. With no clear data, sir, and the DSWD spearheading this, what kind of scenario are you seeing sa mga kababayan niyo dyan sa Cavite, sir?
Well, people here are generally peace loving. I don't think there will be any civil disobedience, but the political consequence will be very high, especially to us incumbents, because they do not distinguish between local and national government. They
Mm-mm.
only know government. And so people down in
I
the
see.
ground think that the money is from the local government, that we're the ones giving it away. But what they don't realize is that it's a national program. So what I'm trying to look for is a equitable solution for all of this, not for politics only, but for really for the people and how to help them.
And what is the equitable solution, Governor?
Well, I would think that the database like Meralco would be the best cases. Number of kilowatt hours consumed equals this much that they pay every
I
month.
see.
Then you can extrapolate how much their disposable income is. There is a formula that you can use.
Okay.
However, if you leave it to human hands to determine who is rich and who is poor and who is poor is the poor, there will always be bias, especially if it passes through um, local officials.
Let me ask you, Governor, how big do you think is your middle class population? Ilagay na po natin
So,
middle class, pati yung sinasabing low income households.
I would say here in Cavite, 500,000 homes are middle class out of 1 million.
That's half, sir.
That's half, yes. We have over 2,000 subdivisions here in the province.
Okay. So, okay, sir, in the absence na maisama po ang middle class for now in the social amelioration program, what can the local government do to help them? All right, we're going to try to get Cavite Governor Jonvic Remulla back on the line. Again, this story is really all about the middle class families, wherein Governor Remulla is asking the government to include them in the social amelioration program. Let's go back to really what the plan of government is regarding this. 18 million families are supposed to be getting about 5 to 8,000 pesos from the social amelioration program, which seemingly does not include the middle class families. We have him back on the line. Governor, pasensya na ho, nawala ho yung ating communication a while ago. So you were saying, I was asking you, in the absence of any help or them, the middle class, being part of the social amelioration program, what can the local government do to help them, sir?
Well, the local government, all we can do is stretch our resources to feed them, to give food packs every day. That's the best we can do. It's impossible for us to financially support every family. Remember, the local government is not fully devolved. If this were a federal system, then we could have had better control. But our funds are simply just not enough. Even if you combine barangay, city, and province, at most we can last for 5 days feeding everyone three times a day. But beyond
Okay.
that, there's nothing left.
Very quickly, I also wanted to add this, sir. I know that you are one step away from full accreditation dito po sa accrediting testing laboratory. Sir, when ho kaya ito when will you be accredited? When will this actually happen? Because this will finally be able to test yung po mga kababayan nyo dyan sa Cavite, sir.
Best efforts, according to De La Salle Health Sciences, is maybe Friday or Saturday. That's the best effort. And we can finish all the PUIs in the province in a matter of 3 days. And after that, then we include everyone from Rizal, from Quezon, from Batangas, and from Laguna. And we will test their PUIs as well. So you have to expect the curve in Calabarzon to have a spike from now that we have maybe 400 amongst the 4 provinces. It will spike up to maybe 3,000 in 1 week.
And there was a warning, sir, from you, no? Sinabi niyo nga na kapag na-identify yung positive cases, they will be isolated and taken care of by the LGUs. Ang ibig sabihin, of course, sir, bawal po ang bisita. And you were saying this will be a very lonely experience.
Yes, we have to prepare them. The Filipinos are used to visiting or staying with someone in the hospital. Yung sanitize sa bantay. But in this case, kung positive na, all of them will be put into one covered courts na well ventilated, and the nurses and doctors will be the ones taking care of them. When it's severe, they will be transferred to the provincial hospital. But 80% of them are moderate and handleable on a covered courts basis. But it's going to be a very lonely experience, and we are forced to keep them together.
Cavite Governor Jonvic Remulla, sir, thank you for your time and take care, sir.
Thank you, Pinky. See you again.
Even basketball players are paying tribute to our frontliners. Listen to some of their messages when we return. This is The Source on CNN Philippines. Welcome back to the program. We want to share some good news too. President Rodrigo Duterte has approved the release of special allowances for government healthcare workers. Administrative Order 28 says all public health workers will receive a one-time special risk allowance. That's equivalent to 25% of their monthly salary. Malacanang says this recognizes the heroism and sacrifices of our frontline medical workers. Basketball stars are also praising our medical frontliners in a series of online videos. Some of the country's well-loved basketball teams share their messages of thanks and encouragement in these challenging times. Here's one from the San Miguel Beermen.
Sobrang na-appreciate po namin ang ginagawa nyo. Alam po namin na hindi po ganun kadali ang sakripisyong binigay nyo. Kaya kami po, kasama po ang aking pamilya, kami po ay taimtim namin kayong pinagdarasal na sana po kayo po ay bigyan ng Panginoon ng maraming lakas, proteksyon at talino para sugpuin ng makalat na sakit na coronavirus. God bless po sa inyong lahat. Maraming salamat po talaga. Saludo po kami sa inyong lahat.
This is a shout out to all the doctors, nurses, and medical staff who are fighting this virus. Our thoughts and prayers are with you and your patients. Stay strong and be healthy. We're doing all we can to help you in this fight. God bless, take care, and
thank you!
thank you.
Lahat ng mga frontliners natin, salamat sa sakripisyo nyo. Kayo yung tunay na most valuable player ng naming mga Pilipino, yung mga frontliners. So, kami ng San Miguel, San Miguel Bearmen, pinag-pray namin kayo na sana safe kayo lagi. Nag-ambag-ambag rin kami ng tulong para sa inyo. Sana makatulong sa pangangailangan nyo. So, ayan, pray lang tayo lagi. Kung malalagpasan din natin to. So, salamat sa inyong lahat. Salamat. Maraming salamat. Saludo kami sa inyo. God bless po.
I want to say thank you. You guys are our heroes to the nurses and doctors out there working. You guys please keep safe. You're always in our prayers. So make sure you take care of yourselves, guys. Thank you.
Oh, this is a very difficult time for all of us, including our heroic nurses and doctors and frontliners. Let's just help them by praying for them and trying to stay at home. We're with you in this fight, and we know we're going to get through this and come out better on the other end.
Hello po sa ating mga healthcare workers, lalo na po sa ating mga doctors at mga nurses. Maraming salamat po sa inyo pong mga sakripisyo at sa inyo pong pagmamalasakit. Asahan nyo po na tutulong po kami sa abot ng aming makakaya at higit sa lahat, lagi po namin kayo isasama sa aming mga panalangin. Maraming salamat po ulit at God bless.
Tayo po ngayon ay nakakaranas ng kakaibang laban. Kaya po maganda pong mangyari, mag-stay po tayo sa ating mga tahanan at huwag na po tayo lumabas dahil napakadelikado po ng COVID-19 na ito. Kami po sa San Miguel Group, ang Ginebra Team, San Miguel Team at Magnolia Team ay nag-usap-usap po at kami po nag-raise ng fund sa maliit na maitutulong po namin sa inyo. Sana po ay makatulong sa inyong mga ginagawang trabaho para maligtas ang mga Pilipinong tao. Maraming po salamat. Saludo po ako sa inyo. Hindi ko po alam kung paano sabihin, kayo po ang totoong matatapang. Salamat po.
Locally made. Still ahead, locally made COVID-19 test kits are now available for commercial use. And what's the story behind this? We'll speak to the man who led the team that developed this game-changing tool after the break. We'll be right back. The Food and Drug Administration greenlights local COVID-19 test kits for commercial use. These are developed by scientists from the University of the Philippines and the Philippine Genome Center. The kit costs around 1,300 each. This is much cheaper than kits now used at hospitals that cost around 8,000 pesos. How will this boost the government's efforts against COVID-19? Let's go straight to the source of the story. Philippine Genome Center Deputy Executive Director, Dr. Raul Destura. Dr. Destura, welcome to the show. Thank you for being here. I'm going to go and ask you already, are the kits available today, sir?
Yes, we are in full manufacturing capacity right now. So we're filling up the initial 26,000 tests that the Department of Science and Technology has asked us to do for its field implementation to all the hospitals identified by the department. and we are continually manufacturing to cover the needs of the other local government units and some other hospitals in order for us to provide more technologies for more Filipinos.
I have to say, Dr. Desura, very exciting news. We've been waiting for this. Of course, you had to go through field validation and a certificate of product registration from the FDA. But tell us more about these test kits. I know you've been working on this for a number of months, sir. Um, how fast can we find out the results? Where can we get these? And how much are they?
Well, the technology is what we call real-time PCR. It actually identifies the what we call the RNA of the virus in such a rapid speed, until it becomes detected by a computer, and it usually lasts for about an hour and an hour and a half per PCR run, and you can get the result after that.
Mm-hmm.
But in reality, when you do it in the laboratory, it takes about you do batching so that you save cost and you save on operation time. So the even if it finishes in an hour and a half, when you do batch testing, it's probably take you a day to get the results.
How much is it, Dr. Destura? Or would it depend on which hospital you'll be going to?
Well, the cost of the technology is 1,320 pesos per tests, and I it, probable additional cost to that is what would be the operational cost in the hospital already. But as a technology, that's the baseline cost. And when we did our calculation, if they're gonna make it really affordable to everybody, it will probably cost in an area between 2,000 if they would add additional cost to the processing and all of the things
Yeah.
that you need around patients to around 3,500.
Dr. Destura, how about the efficiency of these test kits? Tell us more about that. There's no such thing as a false positive or false negative with these test kits?
Well, all technologies, including PCR, are not exempted from false positives and false positive tests. But the factor that would affect a false negative result is one, if the samples were poorly collected. Two, if there is not enough virus in the sample. Third, if the processing is incorrect, then
Okay.
you will have false negative results. And false positive results is, for example,
Can
when the sample gets contaminated by another sample when you are processing them, it can turn positive as well. So
mhm.
good laboratory practice is very crucial in reducing the uh, the cost of false positive and false negativity in terms of this technology.
Let me ask you though, how efficient is this compared to the rapid test kits?
The rapid test kits are what we call serological testing. Its sensitivity and specificity, it's still undergoing study right now. The problem with that one is if we're using
Mhm.
those rapid kits, the its ability to pick up the target is a little bit delayed than directly testing with PCR technology. The higher
Mhm.
versions of these technologies are more laborious but more sensitive. But when you convert them into these test kits, the sensitivity drops because it is an inherent problem of the platform, not because they are not doing it right. It's
I
really
see.
one of the inherent weakness of the technology.
I see. Dr. Destura, can we clarify this again? How many test kits, these COVID-19 test kits, are available now? How many can be produced in a day? And how many um, how many do you intend to produce in totality, sir?
Right now we have 26,000 tests available. Our current manufacturing is from 8,000 to 10,000 tests per day. I'm using the word test because when you say kits, sometimes they understood it as just one test. One kit is like 20 tests in a box. No? So it's easier to understand when I just use the word tests
I
instead of
see.
kits. No? So we use the word test so that it can be converted to one person. So we're manufacturing at maximum capacity at 8,000 tests per day right now. So we're trying to increase it further by increasing our manufacturing sites just to make sure that we can meet the demand of the country, to augment existing kits that has already been donated by other countries in the Philippines.
Dr. Destura, Raul Destura, thank you so much for your time. I'd like to thank you and your group of scientists who worked on this, of course, despite the many challenges that you had to face. Thank you for all your effort.
Thank you very much, Pinky, and for the time to explain things. Thank you very much.
Thank you so much, and thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.